Patel from Albany, New York, discussing the first smartphone application for microsurgery monitoring, SilpaRamanitor. The phrase "there's an app for that" has become synonymous with smartphone usage, as we've started to utilize these devices in everyday aspects of life. The authors of this paper developed a system for using their smartphones in an inexpensive, simple and reliable way to monitor the color of their free flaps. And they created what's really an innovative solution using widely available materials. Amongst surgeons, plastic surgeons are known as innovators, and I was impressed by the way that the authors of this study managed to create an effective model for vascular compromise, and then using that information program an Android app which allowed them to then create a system using limited hardware and equipment costs to monitor free flap color changes. The solution was portable, with widely available hardware in the form of their smartphones, available at low cost and useful both for remote monitoring and as an adjunct to clinical observation. Considering Creech and Miller's description of the ideal flap monitoring device from almost 40 years ago, the author's device was safe to both patients and flaps, could be rapidly used, was found to be reliable in the study, affordable and simple to interpret, which would suggest that it's a very useful tool in flap monitoring. However, based on their findings, I think that clinical observation does still remain the standard for flap monitoring. The study did have a false negative rate of 6%, which in many countries would be considered a high rate of flap compromise. Other disadvantages of the technique are that it can't be applied to buried flaps or to muscle flaps, and the authors do comment on this. In addition, it may not be effective in different skin colors. Some of the problems that the authors didn't consider are that different countries have different requirements for protection of electronic health information. In the United States, we're subject to the HIPAA and HITECH laws, which really mean that protected health information cannot be accessible to anyone else who finds that device or was to access it. I think that further developments of this app need to consider some of these things and include encryption or password protection to make sure that these images that are taken are HIPAA compliant. Another concern is that the app is currently only available on the Android operating system. Now, this does make up the majority of smartphones worldwide, but in the United States there is a significant portion of smartphones that are Apple iPhones, and the app is currently not suitable for that. Another concern that I would have would be, what is the commercial endpoint for this? If this app was to become proprietary, then that certainly wouldn't solve the low cost issue that the authors mention. However, if the program is to be made open source, that would actually open it up to a number of programmers worldwide who could add their experience, add in information from around the world for patients of different skin color, which could potentially make the system much more robust. The importance of this study is that I think it shows the potential for the use of smartphones in day-to-day practice. Whether the future holds the potential for us to be able to monitor free flaps using our smartphones in a much less costly way than we currently monitor flaps, or that the technology continues to develop and we have devices that are either wearable or have augmented reality that enable us to continuously view flaps, remains to be seen. But I think this really does open up the avenues of what could be possible.